Photodynamic therapy is another really interesting type of cancer therapy. In photodynamic therapy, we have selective destruction of cancer cells using light. So what happens in photodynamic therapy is someone is given a photosensitive drug, and it's processed pretty quickly in normal cells, but it stays in cancer cells longer. So it goes throughout the body and it reaches normal cells and cancer cells, but the normal cells get rid of it rather quickly. So the cancer cells are holding on to this photodynamic drug. Then, about like 48 hours later, after we've given normal cells a real good chance to get rid of it, people are exposed to a laser. So that tumor is exposed to a laser, and those cells that still are holding on to the photodynamic medication, so those cancer cells, are exposed to the laser, and it causes irreversible cell damage to those tumor cells. Photodynamic therapy can be used to destroy some cancers. They reduce tumor size. And if it just reduces tumor size, sometimes that can make it easier for other therapies to work better, like even surgically removing it. It can shrink tumors in the esophagus or airways, and that might help relieve some obstruction, help people breathe better, help people swallow better. Photodynamic therapy is most often used for non-melanoma skin cancers. Might be used for ocular tumors, GI tumors, and like I said, lung cancers in the upper airway. Hormonal manipulation, changing someone's usual response to hormones. So hormones are natural substances made by endocrine glands. They're picked up in the blood by the capillaries and they circulate in the blood. Hormones only can exert any kind of effects on their specific target areas. But some hormones actually can make hormone-sensitive tumors grow more rapidly. I'm sure you all have heard about estrogen-sensitive breast cancers. So sometimes, even though these hormones are only supposed to act on their specific target areas, sometimes tumors can be affected by hormone levels as well. So if we decrease the hormone amounts for these hormone-sensitive tumors, their growth is going to be decreased. So a lot of these hormonal manipulation agents are used to block the receptors and prevent these cancer cells from receiving this hormonal growth stimulation. So hormone antagonists bind to these hormone receptors on the tumors and prevent that needed hormone from binding and slow tumor growth. So, for example, like I was discussing the breast cancer, aromatase inhibitors, like anastrozole, prevent the production of estrogen from the adrenal gland. So what that does is it reduces the amount of circulating estrogen, reduces the amount of blood estrogen, and it can help slow the growth of some breast cancers. Of course, we're going to have side effects with hormone therapy. We are going to have masculinizing effects in women, hair on their chest, hair on their face. Menstrual periods can stop and breast tissue can shrink. We are likewise going to potentially have feminizing effects in men where their testes and penises could shrink. They might have gynecomastia. People who are receiving androgens, so essentially male hormones, they might develop acne, hypercalcemia, which could lead to things like renal stones. We could see liver dysfunction. All patients who take estrogens are going to be at increased risk of thromboembolism, and women who take estrogens are going to have irregular menses, and men who take estrogens are going to have gynecomastia. So, and these men also might have some bone loss, which is not what we generally see in males. Decreased facial hair, and like I said, testicular and penile atrophy. Because of all of these changes, we really probably are going to have to consider someone's psychosocial health status and might have to refer them to counseling for body change image and what their general feelings about that are, as well as sexual side effects. So this is gynecomastia on a man. Let's quick touch on some oncologic emergencies, so some cancer-related emergencies. Of course, sepsis can occur in these folks more commonly because, you guessed it, we have bone marrow suppression. So we have suppression of those white blood cells. So possibility of septicemia is increased. DIC, or disseminated intravascular coagulation, can actually be a result of sepsis. So DIC might be caused by gram-negative sepsis. It could also be caused by other illnesses like a viral or bacterial illness. So we have excessive clotting in the small vessels. So when we have this excessive clotting in the small vessels, the body it uses its supply of platelets and clotting factors in those small vessels, diminishing the circulating supply of platelets and clotting factors. So the rest of the body starts to hemorrhage. So we have extensive bleeding from many sites. And then the result, the result could be, minimal bleeding. It could be caught and it could be fine, or we could have a fatal hemorrhage. These clots can block blood vessels and decrease blood flow to major organs. So this could cause pain and stroke-like manifestations, can cause shortness of breath, tachycardia, decreased kidney function, bowel necrosis. DIC is very dangerous. It's highly, highly life-threatening, and it has a super high mortality rate. Prevention is going to be the key for this. So educating patients on good hand hygiene, educating families on good hand hygiene, providing aseptic technique every time we do any kind of intervention. SIADH, or syndrome of inappropriate antidiuretic hormone. So antidiuretic hormone, you probably remember from CHA1, is a hormone that our posterior pituitary gland makes. It makes it when our body feels like we need more fluid retained. So think about this, let's try and break down the word. Antidiuretic hormone. So antidiuretic would mean essentially like anti-pee, so we're keeping fluid in the body. So when our body feels like it needs to keep water around, it makes antidiuretic hormone. But unfortunately, some tumors also make antidiuretic hormone. And some other tumors actually stimulate the posterior pituitary gland. So either a tumor itself might make antidiuretic hormone, or a tumor could stimulate the posterior pituitary gland to secrete antidiuretic hormone. In SIADH, this water is going to be reabsorbed by the kidney and put back into systemic circulation. So this is going to dilute our blood. So our blood sodium level is going to decrease. Some mild manifestations of SIADH are going to be weakness, muscle cramps, fatigue, fluid retention, and edema, weight gain, nervous system changes. But then we can get into some serious manifestations like personality changes, confusion, extreme muscle weakness, seizure, coma, death. Look at the values on the 8th edition, or on page 392 of the 8th edition of IGGI for some information on what we look for in SIADH. You'll want to know those values. In this respect, for patient care, we're going to want to prevent fluid overload, so we're going to probably be giving ordered antidiuretic, ordered diuretics. We're going to have them increase their sodium intake and decrease fluid intake. Spinal cord compression is another oncologic emergency. This could be when a tumor directly involves the spinal cord or spinal column, or if a vertebrae collapses. Sometimes tumors degrade bones, and it could actually make the bone almost fall apart, and it could have some vertebral collapse. This is going to be a common cause of neurological complications. It could lead paralysis, and that paralysis could be permanent if the tumor isn't treated promptly. So our nursing interventions for this are going to be assessing for neurological changes like back pain, muscle weakness, numbness, tingling, unsteady gait. And for this, we could actually be using high-dose steroids for treatment. Hypercalcemia, a lot of tumors, like we said, secrete hormones, and they might secrete parathyroid hormone, and this could cause the bone to release calcium into the blood. So common manifestations of this are going to be skeletal pain from almost like the decrease of that of the bones. Could cause kidney stones, abdominal discomfort, fatigue, nausea, vomiting, muscle weakness, dehydration. Can cause ileus and ECG changes. So on the ECG, the changes might depend on how high the calcium level is and how fast it rose. That's probably what's going to change the cardiac rate and rhythm the most. Oral hydration and diuretics might be enough to make hypercalcemia, to make that better. Superior vena cava syndrome is essentially the compression of the vena cava by lymph nodes and tumors in the chest. Here is a picture of superior vena cava syndrome. So what we see is the appearance of the face, neck, upper arms, and chest. Like it's all going to have kind of a ruddy red hue to it. So the superior vena cava takes all the blood from the cranial, neck, and upper extremities back to the heart. And it's got super thin walls, so anything that is going to compress that area is going to be a problem for the superior vena cava because it can't really push against it. It can't hold its own against those tumors. So compression or obstruction by this tumor or clots can lead to congestion of this area. If it's a gradual thing, if we have a really slow-growing tumor, we're going to probably see collateral circulation, and it's going to be a more slow-growing issue. It might not be something that you notice right away. But this is generally pretty painful for people, and it can be life-threatening. SVC syndrome, if it occurs, it's going to be more frequently in people with lymphomas, especially when they've got mediastinal tumors, or people with lung and breast cancers. One of the interesting things about SVC syndrome is that one of the early manifestations is that when people get up from sleeping in the morning, they're feeling very edematous and puffy in their face. And it gets better as the day goes on, but as they're standing and they're kind of letting that blood flow get away from their head and neck. But as it gets worse, you're going to see that ruddiness and erythema of the upper body, edema in the upper extremities, and it's going to eventually lead to dyspnea. We could see some bloody noses or epistaxis. We could see hemorrhage, cyanosis, mental status changes. We're going to see decreased cardiac output and hypotension. All of this, like I said, could be fatal if it's not relieved. Our last oncologic emergency we're going to talk about is tumor lysis syndrome. In tumor lysis syndrome, large numbers of tumor cells are rapidly destroyed. We think, great, that sounds awesome, but there's bad stuff inside tumors. So their intracellular contents, especially like potassium and purines, and if you remember, purines are those nucleotides that are inside that make up DNA. So potassium and purines are released into the bloodstream, and it's in a manner that we can't really get rid of them. They're released so quickly our body can't really metabolize them and get rid of them. So this is great because it means usually that our treatment is working, but if it goes untreated, it could cause some serious tissue damage. Acute kidney injury is one thing that we see with this, and it can be fatal as well. If it is fatal, it's probably going to be because of hyperkalemia leading to cardiac dysfunction. High level of purines, or those that DNA material, can cause uric acid levels to increase as well, which is also going to potentially damage our kidneys. Tumor lysis syndrome is oftentimes, if it's going to be seen, it's seen in patients receiving chemo or radiation that is very specific to a certain cancer. So if a cancer is very sensitive to a specific chemo or radiation, they have a higher chance of this happening. Good hydration can prevent tumor lysis syndrome, because this is going to help dilute serum potassium and prevent the precipitation of uric acid crystals in the kidney, which is going to help keep us from getting acute kidney injury. So, most patients when they're having treatment for cancer don't feel like drinking, don't feel like staying well hydrated, because they're just feeling so ill and potentially vomiting and nauseous. But we just really have to stress good hydration at this point so that they can avoid tumor lysis syndrome.